disease has no borders, has no boundaries. Once a disease starts in Africa, it will go all over the world.
Most of the diseases that are emerging are coming from animal populations, which is called zoonotic diseases, and a high percentage of those have wildlife associated with them.
H1N1, Ebola, and so on. But all these diseases are related to animals and man and environment interaction.
Respond is a USAID-funded project that's about responding to emerging pandemic threats around the world. And Respond's role is really about the capacity building side, about helping people do a better job around the world, particularly in hotspot areas where these diseases are emerging. One of the first projects that we have done for Respond has been the Global Health Institute that was held in Kampala, Uganda, in August of 2010. And it was really about creating a model for One Health capacity building.
One Health, in this case, the One Health initiative that we are launching and addressing now is focusing on the diseases that have been crossing from animals to man.
One Health is important because it frames health in a much more holistic fashion. And so we're concerned not only about human health, but we're concerned about human health in the context of animal health and in the context of environment.
Theoretical physics has brought forth and proven that indeed everything is connected to everything else. And we're just recognizing that and realizing that in approaching infectious diseases, we can't just look at one thing anymore.
One Health, I think, is for us to have one thinking, one way of doing things.
J'ai beaucoup apprécié ce concept-là qui réunit autour de la santé les différentes disciplines, puisque effectivement on avait tendance à considérer la santé dans un seul domaine. Et maintenant ici, on voit que c'est vraiment très important d'avoir une collaboration avec les différents domaines pour pouvoir arriver à un même but et pour mieux combattre les maladies.
The interaction between animals and humans is very big because it's rare that you go to a family and they have no chicken, no dog, no animal at all. And yet in control and prevention, we do not strongly emphasize that this interaction is a risk factor to diseases.
During the Global Health Institute, we traveled to Queen Elizabeth National Park in Uganda, where the anthrax outbreak was happening, mostly in hippos, but in other animals, in order to give the students exposure and experience to that issue to back up the concepts that we were covering.
So the point of a day like today is to, in one day, make sure that students see the human aspect, the animal aspect, and the domestic animal aspect and the wildlife aspect of One Health, so that they can see the interaction between the types of biology, people and animals, to look at the risks of disease and to look at health as a holistic picture. Some of the striking things we saw today were an elephant that comes into the village and is actually fed by people in a semi-tame manner. It looks fairly well habituated, and a lot of people assuming that this is now a tame elephant. So there's a ton of risks involved with that. And there was a village next to the wildlife area, and all of the canoes and the fishing boats down along the channel, and buffalo and hippo sitting right, literally almost on the canoes with the people sitting next to it. Today we heard a lot of students go, "Oh, now I see what you're talking about."
Another case study that we talked about in the Global Health Institute is the case of emerging infectious diseases and non-human primates, specifically apes. There are a lot of issues with apes and a lot of research going on into the emergence of disease, such as the link between simian immunodeficiency virus, SIV, and HIV, which it evolved into. But apes are one of the main species of concern for these kind of emerging One Health issues.
These people we are training is to create a critical mass that will go back into their countries and address this problem of One Health.
Part of what students will gain here is an appreciation for how people from other countries think about health and act about health.
It's so motivating to meet with people from different countries because you learn more. You meet with different professionals, like the vets from Minnesota, like the public health, the nurses, and the social people. So it's nice for me to meet them and to build a networking. We can even start another project through here.
We get to learn from the students what is the most important or what they think should be done in the future. We get to know what the research is doing. We get to know what is the real practice in the real world. What are the challenges?
Not only were they from different countries, but they were different backgrounds from each country too. There were physicians, nurses, veterinarians, public health folks from the different countries. So just on the day-to-day interactions during the course, working in the groups, we got to hear about different experiences.
We did have over 70 students engaged in this training altogether. We had students from many disciplines. We had students from many sectors, and they were able early on to break the ice and really begin to work together.
So yeah, I mean, there's a lot of card exchanging and email exchanging, and I definitely think, not everybody will work together, but there'll definitely be several of us that will end up, working together. It's a very small world.